Hello there. My name is Casey, and I'm one of the managers in surgical services at Christus St. Vincent. Today, I'm going to talk to you about what you can expect if you are scheduled for a local-only surgery. Local-only surgeries are surgeries where your surgeon will inject your surgical site with numbing medication. You will not receive an IV or any mind-altering medications, and you will be fully awake during the procedure. Typically, over-the-counter medications will provide you the necessary coverage for any discomfort you may have. If your surgeon has decided to prescribe your pain medications, please follow the directions as written. After a local anesthetic surgery, you can usually drive yourself home unless you're having surgery that impedes your ability to drive. When you arrive to the facility, you will be registered by our reception staff. Once they have completed your paperwork, a pre-admission staff member will come to the lobby and escort you to the pre-admission area. In the pre-admission area, you will be asked many times to verify your name and date of birth. This is for your safety. We will then ask you questions about your medical history. You will be asked to change into a gown and lie down on a stretcher. Your vital signs will be checked, including blood pressure, oxygen saturation, and heart monitors will be placed. These monitors will also be used in the operating room and recovery room. Your provider will see you in the pre-admission area before the surgery and can answer any questions you have. Your provider will also mark the correct surgical site and side. You may have the local anesthetic administered in the pre-admission area, or this may be done in the operating room. You'll be asked to participate in a timeout with your pre-admission nurse and your operating room nurse. The timeout simply will consist of you verifying your name and date of birth, as well as the surgery that you'll be having. Once the pre-admission team and the OR team have verified all of the necessary paperwork, you will then be escorted into the operating room. The operating room team consists of nurses and a scrub tech. The operating room is usually cold, and warm blankets will be provided. Your team will reattach you to the vital sign monitors that will stay on during your entire stay. A tourniquet may be placed on your upper arm if you are having an upper extremity surgery. One of the nurses will prep or wash your surgical site with special soap. The surgical tech will then drape the surgical site with sterile drapes. An additional timeout involving all team members will be completed, which is very similar to the one you experienced in the pre-admission area. Because the surgical site has been numbed, you should not feel any pain. However, you may feel pulling, pressure, or movement. If you do have pain during the surgery, please let your surgeon know so that they can inject some more numbing medicine. When the surgery is finished, the surgeon and the team will place a dressing to your surgical site. The monitors will be removed and you will be wheeled into the recovery room. When you arrive to the recovery room, your name and date of birth will be verified yet again. The vital sign monitors will be reattached and one set of vitals will be taken. The vital sign monitors will then be removed and you will be asked to put on your own clothing. This is to ensure you are able to dress yourself and you are ready to go home. You will receive a printed copy of specific discharge instructions to go home with after the nurse has reviewed them with you and all of your questions have been answered. If any devices like a brace have been ordered for you, this will be provided prior to discharge. You will also receive a phone call from our recovery room staff within 24 to 48 hours to see how you are doing. As always, we thank you for choosing Christus St. Vincent Surgical Services for your surgery today.